Good afternoon and welcome to this webinar. My name is Hamza Altaf. I'm one of the trainers over here in MTBC Tech Team. In today's webinar, I will talk about a new functionality that has been enabled on our WebEHR, and that is evaluation and management visit. Before we start our session, let me tell you guys, if you have any questions, you can write them down in the comment box below the webinar window, and your questions will be answered at the end of the session. If we don't have time to answer your questions will be answered in the email that you have provided. An email would be sent to you with the right answers. Now, E&M is the process by which the office visit encounters are translated into 5-digit CPT codes to obtain reimbursement from the payers. The purpose of this project is to determine and suggest the office visit CPTs to the provider in real time as they fill patient charts in WebEHR, so that they can get the right reimbursements from the payers according to the intensity of the cognitive labor performed by the physician. Let me quote an example here. We have some by telling you a code. Let's say 99213. That's a normal code that you guys use for an office visit encounter. Now you can either use 99213, 99214, or 99215. Now the reimbursement rate on 99215 is a bit higher than 99214, and the reimbursement rate on 99214 is higher than the reimbursement rate on 99213. Now, how you will justify to use 99215 in your chart will be the basis of this evaluation and management visit. Now, if you're using the code 99215, the reimbursement rate on that code is very high than 99213. Now, once you use that, you will have to justify in your chart that you have performed the right cognitive labor to use that code. There are two approaches to calculate E&M code in EHR, evaluation and management calculator, and time-based evaluation and management. The office visit CPTs are suggested on the basis of following components: history, physical exam, and medical decision making, MDM. If we break it down for you, there are basically three sections in the evaluation and management visit: history, physical exam, and medical decision making. Now, history is further divided into three components: HPI, history of presenting illness; review of systems; past family and social history; and then we have physical exam. After that, the most important component is medical decision making. That is further divided into medical problems, problem points, data points, and risk factors. Now, the physicians who are using our WebEHR would be very familiar with this page. This is the chart that you guys are creating on WebEHR. Now, if you are on that chart page, on the bottom left-hand side, of this page, you'll see an E&M visit. Now, as soon as you click on it, this pop-up will appear. Now, at the moment, since we are talking about the evaluation and management calculator, you will hit OK. And the window that you see on the right hand side will appear on your screen. And as you can see, the history is divided into HPI elements, review of system elements, patient's family and social history. And then we have the physical examination. After that, the medical decision making is a series of questions, and the code or the number of decision-making items that you answer yes would be a point each or 2 points each. And at the bottom, you will get your final result. Now, HPI levels, the information that you are putting in the chart can be none, brief, or extended. And the code that will be suggested to you by the E&M widget will be based on that information. Now, review of system levels would be none, problem pertinent, extended, and complete. And past family and social history levels, they'll be none, problem pertinent, and complete, depending on the cognitive labor that you're performing in that chart. If there is extensive detail, uh, obviously the levels would be complete. If there is less detail, for example, the levels would be none or problem pertinent in past family and social history levels. Now, what is brief HPI? If free text is entered in HPI or there are less than or equal to 3 HPI elements documented, that would be a brief HPI in terms of evaluation and management. Extended HPI, if there are 4 or more HPI elements documented. Now, when we talk about the elements, what are those? If you're creating the patient chart under HPI, on the far right hand side, you'll see a tab for HPI details. As soon as you click on it, this window opens. Now, on the basis of the detail you're providing in terms of the items, that would be the basis of the E&M visit calculator. Now, extended would be if there are 4 or more elements documented. This HPI detail is not extended. A review of system is an inventory of body systems obtained through a series of questions seeking to identify signs or symptoms which the patient may be experiencing or has experienced. There are 14 individual systems recognized by the E&M guidelines, starting from constitutional to allergic. A problem pertinent review system that requires detail for one system related to the current problem or problems. Extended review of system requires detail for 2 to 9 systems, the patient's positive responses and pertinent negatives for 2 to 9 systems. A complete review of system requires review details for 10 or more systems. Example for having one system related to current problem, that would be a problem pertinent review of system. As you can see, one system is selected and there are 3 elements documented in the list. Example for extended review of system, having review details for 2 to 9 systems. As you can see on the left hand side, there are in total 7 systems documented with their corresponding items on the right hand side. That would be an example of an extended review of systems. The more detail you provide, the more cognitive labor you performed on this chart related to patient's medical condition, the more reimbursement you get from the peers. And the code that will be selected at the end would be a code that will result in a higher reimbursement rate. Past family and social history. And the detail provided in past family and social history can be none, problem pertinent, one item from past family and social history, complete, 2 or more items from past family and social history. Details entered in any of the group social history sections will be counted as one entry, as you can see below. Social history is 1 item, tobacco usage 1 item, risk factors, and then miscellaneous usage. And the family history against distinct relationships will be counted as 1 entry. To qualify for a given level of history, all 3 elements, HPI, review of systems, patient's family and social history, must be met. Now, if the history provided is problem focus, this requires only 1 brief HPI. As you can see in this table, 1 brief HPI, no review of system, and no patient's family and social history item. If the history provided by is extended problem focused, there will be a brief HPI in it, 1 pertinent review of system, and no patient's family and social history item. If the history is detailed, the HPI will be extended. There will be 2 to 9 review of system items, and there should be 1 out of 3 patient's family and social history items. And that would be an extended review of system and a pertinent patient's family and social history. On the other hand, a comprehensive history requires extended HPI, complete review of system, and a complete patient's family and social history, meaning 10 review of system items and 3 out of 3 patient's family and social history items. Moving on to the physical exam. Now, there are 12 body systems and 7 body areas recognized by the E&M guidelines. Body systems starting from constitutional to skin, and body areas includes head, neck, chest, abdomen, genitalia, back, and each extremely. Now, our problem-focused physical exam would be 1 to 5 elements in 1 or more systems or body areas. An extended problem-focused would be 6 to 11 elements in 1 or more system or body areas. A detailed physical exam level would be at least 2 elements from at least 6 body and system areas, or at least 12 items from 2 or more systems or body areas. On the other hand, if you're looking for a comprehensive physical exam level, 9 systems or more and at least 2 elements from each selective system body areas should be documented. Now, example for a problem focus level. As you can see, in problem focused, 1 to 5 elements in 1 or more systems or body areas should be documented. As you can see right there on the left hand side, 1 physical exam system is selected and 2 bulleted elements are selected. That would be a good example for a problem focused physical exam. Medical decision making. Now, this is the most important of all the 3 key components because it reflects the intensity of the cognitive labor performed by the physician in his office. Now, levels of evaluation and management services recognizes 4 types of medical decision making. The level is straightforward, level is with low complexity, moderate complexity, and high complexity. There are 3 main components of medical decision making. Problem points, the number of diagnosis or management options selected, data points, amount or complexity of data reviewed by the physician, risk points, the risk of complications. Now, problem points will be defined on the total points from number of assessments that lie in the following status categories. The problem is self-limited or minor, should be maximum of 2 problems, the points will be 1. Established problem, stable or improving, there'll be 1 point for that. Established problem worsening, there'll be 2 points for that. New problem with no additional workup planned, you can document maximum of 1 problem. The points for that is 3. New problem with additional workup planned, there'll be in total 4 points for that. Now, the physicians who are creating charts on WebEHR would be familiar that as soon as you click on the assessment and the such assessments and procedures section, a pop-up opens, which is like that. As soon as you click on the assessment, let's say on 462, you will see this pop-up in which you will put in the type, status, the diagnosed chronicity, and the degree. Now, this section is under the assessments and procedures in the chart that you're creating on WebEHR. As soon as you click on assessments and procedures, you will either add an assessment or you can click on an existing assessment and you will see this pop-up window. Now, if the problem is self-limited or a minor problem, the degree would be self-limited. If it's an established problem, stable or improved, the degree in that pop-up would be same or improved. If it's an established problem, worsening, the degree would be worse. If it's a new problem, no additional workup planned, the chronicity would be acute, and against that assessment, the care plan type is selected from those not highlighted below. For example, care plan, clinical instructions, patient decision aids. If it's a new problem, additional workup plan, the chronicity would be acute and one or more care plan type from those highlighted above. Referral, observation, encounter, substance administration, procedure. Now, all active assessments will be present in the drop-down from chart, assessment, and procedures module. On this slide, the degree that you see, you will select that. As soon as you click on that assessment window, a pop-up will appear and you will select the degree here. The data points will be based on the questions answered yes by the provider in the MDM section. Now in the medical decision making section, there are some questions, and the points that you will get will be defined by the questions answered yes by the physician. For example, a review or order of clinical lab tests, there'll be a point for that. Review or order test in the radiology section of CPT, there'll be a point for that as well. Review or order of tests in the medicine section of CPT, there'll be a point for that. Discussion of test results with performing physician, there'll be a point for that as well. Decision to obtain old records or history from someone other than the patient, there'll be a point for that. Now there'll be 2 points for review and summarization of old records or obtaining history from someone other than the patient, or discussion of case with another healthcare provider. There'll be 2 points for that if you answer yes. Independent visualization of image, tracing, or specimen itself, not simply just review of the report, there'll be 2 points for that as well. Now, on the basis of questions answered yes, there'll be points awarded, and the code as a result that will populate at the end would be a code that would result in more reimbursement from the payers. Now, risk levels are based on the 3 factors: presenting problems, diagnostic procedures, management options selected. Risk presenting problem would be based on assessment status, degree, and chronicity. You will see this pop up as soon as you click on the assessment. You would be able to modify the status, diagnose chronicity, and the degree. And the presenting problem would be based on the items that you select under these sections. Now, diagnostic procedures would be based on CPT or SNOMED codes found in patient charts that lie under the following categories. Management option selected would be based on many factors like CPT or SNOMED codes present in patient charts, type of medications prescribed to the patients, and care plan decided. Now, if the presenting problem is, for example, cold, insect bite, or something like that, the level of risk would be minimal, and as a result, the diagnostic procedure applied would be, let's say, chest X-rays. The management option selected would be rest or goggles. On the other hand, if the presenting problem is one or more chronic illnesses with severe exacerbation, progression, or side effects of treatment, the level of risk would be very high. The diagnostic procedures in that case would be diagnostic endoscopies with identified risk factors. And as a result, the management option selected would be extensive as well: parenteral control substances. Now, overall, MDM will be calculated on the basis of following criteria. If in the medical decision making, the problem is of minimum complexity, the problem point selected would be 1, the data points would be 1, and the risk would be minimal. If the risk is low, the data points would be 2, problem points would be 2, and medical decision making would be low in complexity. If the risk is moderate, the data points would be higher, 3, the problem points would be 3, and the medical decision making would be of moderate complexity. And on the other hand, if the risk is high, the data points would be high as well. 4, problem points would be 4, and the medical decision making would be of high complexity. The final code is based on the level of each of 3 main sections: history, physical exam, and medical decision making. Clicking on the code in the patient charts, the button that you'll see at the bottom, assign suggested CPT code, will add the suggested CPT code in patient's chart. These values that you see are populated automatically as you perform the cognitive labor on that patient's chart. If the HPI elements were 1 to 3, the level would be brief. If the review of systems elements were 2 to 9 elements, the level would be extended for review of system. If the patient's family and social history elements, let's say 0 elements, the level would be none. If you move to physical exam, exam elements would be, let's say, 2 to 4 elements. The code that is selected is 99213, and the level would be brief. And in the medical decision making, as we talked before, on the basis of the answers that you answer yes, would give you a point each, or in some cases 2 points each. And as a result, if you answered yes or if you answered no, the code that you will get will be on a higher reimbursement scale if the answers were yes. If the answers were answered no, the reimbursement rate of the code selected would be on the low side in terms of reimbursement from the payers. And at the end, you will get the final result. As soon as you click on assign suggested CPT, you would be able to use that code in the patient chart as well. Now, the second section we have is on time-based. I mean, the amount of time you spend on that patient chart, you can simply go ahead and select that time. The suggested E&M code will reflect by the selection of time spent during patient visit. For example, if you spend 10 minutes with the patient, you spend 20 minutes, you spend 30, you spend 40 minutes. And on the basis of the time spent with the patient, the code will be selected on that basis. And on the basis of the time that you have spent, the reimbursement rate of that code would be high or low. For example, if more time is spent with the patient, the CPT suggested CPT code that you see in the result would be on the higher reimbursement side. On the other hand, if you select only 10 minutes and assign the CPT code, that will be on the low reimbursement side in terms of getting the money from the payers. This is pretty much we have for today's webinar. As I told you in the beginning, if you guys have any questions, feel free to write them down in the question sections that you will see on the webinar window, and I would be glad to answer those questions. If you wish to email us, you can email us to at info@mtbc.com, or you can call tech support anytime at 732-873-5133, extension 102. You can ask for me by first name. My first name is Hamza. If I'm not available, anyone in tech team would be glad to help you guys out. If you guys have any questions, feel free to write them down. All right, guys, thank you so much for listening to this webinar. As I told you before, if you guys have any questions later on, you can call me back at 732-873-5133. My extension is 102. If I'm not available, anyone in tech team would be glad to help you guys out. Thank you, and have a good day now.